let's go ahead and begin. And I know there were some people that were unsure they were going to be able to join us as we began. So we wanted to just let you know we're also going to have this recorded. We'll be able to send that out. I know Teresa was especially concerned because she said she wasn't sure how good her internet connection was going to be. I also want to mention that we are using the webinar software of our sister organization, which is Lay Mission Helpers. So you may see an email address that reflects this. This is actually our first time doing a webinar, as we've really enjoyed our face-to-face retreat seminars. So if we find we're going to be doing this more often, we will spring for our own copy of the software. But since this is our first time doing it, please forgive any missteps we make while trying to present this. And thank you very much for your patience. If you have any questions at this time, I want to invite you to type them into the questions box, and we will address them either as they come in or at the end of the presentation. And again, we do want to just say thank you very much for joining us. I want to share with you the mission of our organization. Following Christ's call to heal the sick, Mission Doctors Association provides life-saving medical care for the poor and training for local health professionals around the world. This mission statement reflects both the direct care and training that all of our doctors are involved with. Our goal is always to work ourselves out of a job. So we always say that Mission Doctors is a mission of healing and a partnership of hope, because some serve and others do make their service possible. My name is Elise Frederick, and I'm the Executive Director of Mission Doctors. And given the directions, obviously, of public health departments across the country, we're sharing this today via the internet in lieu of our annual planned retreat seminar. I'm sharing this with you from my home in Southern California, and we have Tim Kavanaugh joining us from Arizona. Tim and his wife Sheila served 3 years in Zimbabwe and have done subsequent short-term missions in Cameroon. Tim also serves on our board of directors and will be available for the Q&A portion of our time together. Tim, would you like to say anything at this point?
Oh, just good afternoon. I'm sitting here in South Scottsdale, Arizona, and I have to echo, I really missed the weekends together. Those have been just lovely gatherings, but we do what we have to do, I guess.
Exactly. We're all adapting to this current new reality and are looking forward to being on the other side of it. Jessica is our communication director, and she is also on the call to help facilitate the webinar and is available to respond to your questions via the questions box as well if you're experiencing any difficulty with the app. So I like to start at the beginning, and we do have a very unique mission to share. Our founder, Msgr Anthony Brouwers, had traveled to Africa to attend the Marian Congress in Lagos, Nigeria in 1964. He was the director of the propagation of the faith in the Archdiocese of Los Angeles. And when that Congress was over, he stayed in Africa. He wrote later that he had traveled by boat and jeeps and on foot. He said that he wanted to learn how those of us in the United States could be of help for our sisters and brothers around the world. He later said that what he had expected to hear was, Monsignor, go back to the United States and raise money so we can build a church or a school or a hospital. And he said, while there were requests for funds, there were 3 words that he heard over and over again. We need help. He met sisters with no training, pulling teeth, and that actually hurts me to think about it. Priests who spent most of their time with construction projects. God bless you, Tim. He met one bishop who spent part of his time delivering the mail and also repairing the jeeps. So Monsignor returned to Los Angeles with what was then a revolutionary idea. Now remember, this is before Vatican II. He wanted to help make it possible for Catholic professionals to answer the call to share their gifts and live their faith. So in 1965, Monsignor created, as part of the mission office, the Lay Mission Helpers Association to recruit, train, send, and support teachers, nurses, administrators, and engineers who would serve for 3 years. And then in 1959, working with our local Catholic Physicians Guild, founded the Mission Doctors Association. And this was founded as an independent 501c3 organization. Last year was our 60th anniversary, something we're very proud of. These two organizations were the first lay Catholic sending programs in the United States. From the beginning, the program provided formation for the 3-year program to prepare Catholic lay people to serve as true missionaries. Originally, when my husband and I went through the formation program, it was held 2 evenings a week and on Sunday afternoon for 9 months. Now, this meant for those from outside the LA area, there was a need to move to Los Angeles, find housing and jobs for those 9 months. And because California does not have reciprocity with any other state, this really created a stumbling block for some doctors who were interested in serving. By the time Tim and Sheila came through the formation program, it had changed to a 4-month residential program. Those preparing to serve live in communities, both the mission doctors and lay mission helpers, at our mission house and have classes 5 days a week. Classes are in scripture, mission theology, Catholic social teaching, and adult formation. In 1997, Mission Doctors began the short-term program. We kept calling it our new program. I guess we probably shouldn't since 1997 and now, for doctors who were interested in serving 1 to 3 months. The retreat seminars are held to provide some of the tools that can help make service possible. Generally, it's our goal to send these doctors to locations where we have doctors serving long-term. Obviously, this makes it easier to hit the ground running. At this time, obviously, due to the coronavirus, we will not be sending anyone to any of our sites. However, we also want to look beyond this moment because we are hoping and planning beyond this, as I'm sure we all are. Ghana, the Jennings family, have been serving in a Fuega hospital in the Volta region in the Diocese of Ho. Robin and Brian and their children began their 3-year assignment in January. They're both family practice physicians with OB experience. This diocese has 2 hospitals, this and Margaret Marquardt, where we have also sent mission doctors. Additionally, in the diocese in the north, they are specifically requesting a surgeon. We are not at this hospital at this time, but there are lay mission helpers in this diocese. But we hope to expand to this location with a long-term doctor in the next year. In Peru, we have served and worked at Santa Clotilde Hospital in the far north Amazon region. Here, they are seeking doctors who are fluent in Spanish and have experience with C-sections. One of the things that makes this location very unique is there are 2 priest physicians who worked here for over 30 years. They've both since retired, but they developed a special relationship with the Ministry of Health to care for the 20,000 people living up and down the Napo River. The Ministry of Health provides ancillary medical professionals and provides some assistance with medicine and other salaries. 2 of our doctors, a young married couple who've served here, are from Chicago, Tony Lulo and Brian Metternack. They have offered to be a contact for anyone wishing to learn more about this location. They do continue their relationship with Santa Clotilde. After completing their 3 years, they both return annually. Tanzania, we are in Tanzania in the far north, in the Same Mountains. Dr. Mark and Mrs. Molly Druffner have been visiting this Bwambo hospital as well as doing community outreach since 2010. They also take short-term doctors here to provide primary and specialist care when they go. And the Druffners live in Minnesota and are always happy to be a contact for anyone who would be considering this location. In Uganda, there are 3 hospitals in the Diocese of Kabale in the southwest that continue to seek mission doctors. We are following the Ebola outbreak very closely and had suspended sending new people to Uganda because of the proximity to the Congo. We are hopeful, as we are hopeful of so many things, that if the current trends continue, once the coronavirus is also contained, we will be able to answer these requests. Most primary care specialists are able to serve at one of these locations, but we've also sent pediatricians and OBGYNs to Karilawanga Hospital. Also, at this location, Mission doctors helped facilitate the construction of an emergency room. It was at that time only the second emergency room in the country, the other one being in the capital. A young doctor from Harvard who had come to work with one of our surgeons subsequently created a training program for nurses in triage. And these nurses have been able to move out to other hospitals and improve the care that is provided there as well. Now, there are other sites that we have relationships with, and obviously we're hoping to continue to expand those. But just to give you an overview of some of the current sites. At the retreat seminars, obviously, while we were not able to offer you the full retreat seminar, I do just want to give you a bit more information, because we do hope you will join us when we're able to schedule one again, either here in Los Angeles at LMU. Generally, we do this in the spring, or in Chicago at Loyola Stritch Medical School, which we generally have in the fall. Brother John Kiesler is a missiology professor at the Franciscan School of Theology at the University of San Diego. He provides a presentation on the theology of mission. Brother John is also a member of the faculty for the long-term program. He teaches every Friday in that class. And he's also a member of the Mission Doctors Board of Directors. Dr. Lou Koda and his wife Marty, they literally just returned from Uganda. Lou always has a presentation on the spirituality for a Catholic physician. Tim Kavanaugh provides information and resources on HIV, TB, and malaria, as well as how to stay healthy in service, because obviously that's very important. Other doctors who served in many of the locations are on hand also to provide more detailed information on the specific sites. We also discuss the important role that culture plays, especially how it impacts the interaction for medical professionals when you're serving in another culture, as well as providing information on licensing and visas. And we know that everyone is very busy right now, especially healthcare professionals, at this unprecedented moment. And we really are grateful that you would take a little time to be with us. But we wanted to just give that brief overview and also give you the opportunity to have your questions answered. So if you have a question, you can go ahead and type it into the question box. And I thought I would, while we're waiting for someone to do that, I thought I would start with one of the questions that we are so often asked. One of the questions asked, it usually comes up, we cover this information on the Sunday portion of the retreat. It's, where do we go from here? So we hope that during the course of a weekend, we have provided more information, videos, slides, a lot more information on the locations, that by the end of the weekend, you might have an idea about a specific site that seems like a good match for your professional skills. We say it is best to allow 3 to 6 months to make a plan to serve, because we need to coordinate that with the location to ensure housing is available, to ensure that at the time you are interested in serving, obviously, then there's a need. Some of the locations where we have served, time is obviously very important, because they may have in the past have had groups of specialists coming in to provide either orthopedic or cardiac care. So we always want to make sure that we are sensitive to the needs of the location as well. So each location also has very different regulations regarding visas and even the documentation that is necessary to practice medicine. So there is not a general answer to this question. What we have seen is a growing trend to ensure that those planning to practice medicine are fully qualified to do so. It's a trend we're really happy, because we only send fully qualified individuals. And it's also, though, obviously changing the amount of documentation that may be required in advance. So for each location, I have that information. And if I gave it to you now, it would probably change by the next time it needs to be done. So it's always best to be working very specifically about a site and timing, and we can always update on what would be required. Sometimes some of the locations you just bring your license with you. Other locations you need to provide documentation in advance. So we'll work from that. And I think, Tim, you had mentioned one of the questions you were going to answer was, what do I need to know to travel and work safely in medical mission countries?
Yeah, and you want me to speak to that, or?
Yes, please.
I figured that. Well, it really kind of falls into two categories. One is just what anyone needs to travel outside of the United States, to travel internationally. And what I've done is I've got a handout. I think I sent it to you, Lisa. That what I did is I took down our multi-page reference list, and I sat there and said, since no one's going right now, if someone was considering saying at some point when things open up again, I would like to consider mission service, what do I need to know? And so I've included the yellow book, which is essentially the most important book that you can have to sit there and to flip through and to learn to travel anywhere outside the United States. And the second are some books to sit there and say, if you like when I first started there, I sat there and said, I really have no business going and doing mission medicine because I've never seen a case of malaria, I've never seen Suzuki fever, and the list goes on and on. And it just is, there are three references to sit there and say, how do I learn about tropical / mission medicine so I can provide good care when I go out there? And there are three books that I've suggested just as starting point. If anybody wants the whole list, I can certainly give them to them. And then also to address your question about some of the move towards requiring more documentation of a person's ability to practice, I've included some kind of ethical articles that really involve things like what are called short-term experiences in global health, where essentially they're laudable programs, but they're not what Mission Doctor does. A lot of it is introducing students and residents to global health issues. And again, we go out there to serve as fully licensed and trained physicians, but just so that you can sit there and understand some of the questions that surround mission medicine at this time. So, and again, I cut it down to one page, which was hard to do, but if anybody wants the full list, I could certainly send out to them too. So
we'll send that list out following this call. Thank you, Tim.
Okay.
Tim, I had someone ask the question, is there a need for internist? And I think, my answer would be yes, because, we're at a lot of hospitals. Would you like to address that more fully?
Oh, yes. I think the short answer is yes. There's a need for internists. And I think in a couple of reasons. One is that in most, mission hospitals, that people in resource-limited countries that have been trained in medicine have surgical skills that far exceed those we get in medical school and residency in the United States. But again, if you have limited formularies in that, you may have one ACE inhibitor, you may have a limited selection of medications. And so, taking people with chronic medical problems that are degenerative illnesses, which is actually an increasing problem now as people live longer, to sit there and to not only treat people, but to help your local, coworkers to kind of learn how to manage chronic adult medical illnesses is vital. So it's an important thing right now, but it's only growing in importance.
Thank you, Tim. I hope that answers your question. Another question that we are often asked is regarding the faith component. Many people may have served with other Christian organizations who might view medical missionary work more in the light of proselytizing. And we're asked, how does that factor into the work of MDA? And while our doctors serve at Catholic hospitals at the invitation of the local bishop, they care for people of all faiths, with the expectation is that they will be serving in light of their faith, and that faith will be easy for people to witness. I think the quote that's often attributed to St. Francis, I think Brother John told me should not be, but it's that, preach at all times and use words only when necessary. I think this really fits the way MDA views our service. It is that people see the way you interact with patients, their families, the staff. They may see that you get up and go to early daily mass. So this is a far greater way to share your faith. And I think that what we've seen and what we've been told over and over again by the sisters who run the hospitals, by the bishops, by the religious who are in country, is that this witness is so powerful. I always like to quote Tim. I tell this story of that Tim shared. So I'd let you share it about the photo of your daughters on your desk, Tim.
Oh, well, I think just to reiterate what you've said, you proselytize and you proclaim your faith and your hope the same way you do here in the United States. Because if you're, the places I've been to, I would either go to daily mass with 20 or 25 nuns, or with you go to daily mass with 400 boarding school students, and so and the masses are 2 hours and 4.5 hours. So essentially you learn more about your faith going on mission service than you do teaching other people. But what I would do is that I would I had a picture of our 4 daughters. We had 4 daughters in college when we went to Zimbabwe for 3 years, and I just set that picture on my desk. And people, they'd always come in there and sit there and say, "Who are those?" And we say, "Well, they're my daughters. Are they here with you?" "No, they're in the United States." And that would always lead to them sitting and looking for me and going, "Why are you here?" And to that answer is that you sit there, and the answer was always the same, and it was that I'm here because there's a group of people in the United States that knew that you needed doctors, that knew kind of how you were suffering, and they sent me. And that would always end the conversation. It would sit there and just kind of look at the picture, and that was the answer, and that was the end of it. So.
Yeah, and I think that's just such a strong witness. I really do. Thanks, Tim. We had a question regarding surgeons. I said right now it looked like there were only 2 locations for surgeons. We, we were in Cameroon for over 30 years, and due to the civil unrest there, unfortunately, we're not there now. And this is the kind of thing that happens, as we are. Our goal is to work ourselves out of a job, and we've been able to do that in some locations. But in others, sometimes we are on a pause because of issues that are beyond our control. So I am hopeful that we will continue to expand opportunities for surgeons and all specialists. But right now, certainly there are opportunities. They are the one in the north of Uganda. I mean, they have specifically, the bishop has specifically requested this from me several times, and so I know that he is very interested. I think basically their physicians on hand would really benefit from having a U.S. trained surgeon to be able to spend some time with them, to be able to provide, additional time for them to witness and to learn as well. So at this time, that's where we are for surgeons, but it is definitely something we hope to continue to expand because, as I said, Cameroon, we could have sent everyone from, orthopedists to cardiologists, interventional cardiologists even. So we are always on that, and our invitation always comes from the bishop. So it's the local bishop who always opens the door for us to serve, and we find that has always been to our benefit. I think you answered this a bit, Tim, on how do you prepare professionally to provide good medicine. I think, and that's a lot of that is going to be in that document that we're going to send out. Is that right, or is there additional?
Yeah, and essentially what I've done, again, I've pared it down to 3 books. One is there's a series of tropical medicine lecture notes done by Beeching and Gill that literally, if you sit there and read it over several days, you will sit there and you'll have a feeling anyway that you completely understand tropical medicine. They're an exceptional introduction. And then also, I've included my favorite little handbook from Oxford. And then lastly, down the hill from us in northwestern Cameroon was a Baptist hospital with Dr. Dennis Palmer and Catherine Wolfe. And they wrote essentially what is the Washington Manual for Mission Medicine. And that is like, don't leave home without a kind of a book. Those 3 books, I think, will bring you up to speed very, very well.
Yeah. Yeah. So, we really do just, obviously, we didn't want to take a lot of everyone's time because we know everyone is busy. If you have another question, go ahead and pop it in the box. I do want to just let you know how much we're looking forward to connecting with you at a retreat. And as soon as we are able to get our next one scheduled, either here in Los Angeles, we will certainly get that information out to you. And, just really, and I would be grateful also when we send that, we send the audio of this to you, as well as Tim's additional information. We'll send those out together. when we're able to send that out, we'd be grateful to get your feedback on this, to see if you found this helpful, if you thought this was a good way for us to kind of bridge the gap between coronavirus and retreat seminars. So I do look forward to your feedback as well. We thank you again for being with us. And you all have my email. So if any questions come up or you think of something after the call that you want to ask and you'd like me to direct it to Tim, more than happy to do that. So happy to be in touch with you, and I look forward to being in touch again. Take care and God bless. Everyone stay well.